The rate of rise in a temperature for a child can be up to 5 times higher than an adult. So children heat up at a much faster rate than an adult does. And when a temperature is at 104 degrees or higher, organs start to shut down. And so leaving a child in a car, even for minutes, can be impactful to their organs and be devastating. That's when organ demise starts to happen and organ dysfunction starts to happen at 104 degrees Fahrenheit. And consequences really start to happen, including organ death, around 107 degrees Fahrenheit. Being vigilant is really important, and I think having a routine or practice habit every single time, no matter the season, is important. And so a good habit would be to leave your bag or employee ID in the back seat. And so even if your child's not in the car, you're forced to go to the back seat, open it, check, and then enter whatever facility or place that you need to. And so leaving something essential in the back seat every single time is important. I do want to make a note that even if it's 60, 70, 80 degrees and opening a window, we've seen cases where that's not effective. So if you have to go into the grocery store or to the bank and think, hey, I'm going to leave my child inside the car seat in the back seat, but I'm going to keep the window cracked open, we've seen consequences, unfortunate consequences when that happens. So I really urge parents not to intentionally ever leave their child in the back seat, even with a window open. It comes down to heat stroke and the degree of organ dysfunction. So anywhere from kidney failure, neurological consequences, every organ is affected when a child's temperature reaches that critical threshold. And when I was talking about temperature earlier, I meant about the child's internal temperature, not the temperature in the car. So if a child reaches an internal temperature of 107 degrees Fahrenheit, they can have permanent neurological damage, permanent kidney damage. Every organ is almost affected. And so, the big message is vigilance, good routine and best practices of always checking the backseat of your car, and then having some safety lock measures to make sure that the cars are locked when you're parked and a child's not accidentally getting inside and stuck. About 90% of all pediatric deaths related to a child being inside of a car are children 3 years of age or less. And so sometimes a child can be napping or sleeping and you forget that they're in the car. And so it's really about vigilance in every single month. And I know it gets more attention in summer months, as it should, but having a good routine and practice every single day is really important. Our body is really regulated under a certain normal temperature range, and at that temperature range, a lot of proteins denature, enzymes don't work as properly, and these organs aren't functioning properly at that high temperature. So extremes in temperature, cold or high, can have really impactful consequences to any organ. But what makes this so critical for children is that children, their rate of rise of their temperature is at a much faster pace than adults. And so they don't regulate their temperature to the same degree and have the same protective mechanisms like you and I do.